This is the 2018 Distance Learning and Telemedicine Program webinar. My name is Randall Milheiser, and I'm a member of the Loan Origination and Approval Division, RUS Telecom. The program purpose. The program provides or improves distance learning and/or telemedicine services in rural America by funding equipment that allows rural residents to access distance learning or telemedicine services from hub sites located in larger urban or suburban areas. This is overcoming the effects of remoteness and low population density. Distance learning. Distance learning means the synchronous delivery of curriculum via telecommunications and promotes the communication of students and teachers at remote sites. Distance learning provides educational programs, instruction, or information originating in one area, whether rural or not, to students and teachers who are located in rural areas, or connects teachers and students located in one rural area with teachers and students that are located in a different rural area. Telemedicine. Telemedicine is a synchronous telecommunications link to an end user from medical professionals at separate sites in order to exchange healthcare information for the purpose of providing improved healthcare services to residents of rural areas. Telemedicine shows benefits to rural residents either in reduced travel or improved access to service. This slide is a review of the funding for this year and the past 2 years. In FY16, we had $23.4 million available. We had 182 applications received. 98 applications were approved for $27.7 million. The reason the amount approved is higher than the available is because when distance learning and telemedicine grants, money is left over, the money is rescinded and put back in the pot, and we are allowed to award that to new applications. In FY 2017, we had $23.6 million available. We had 208 applications received, 86 applications approved for $27.7 million. Again, it's because additional monies or rescinded funds was put back into the pot and made available for awarding to new grants. We had 46 distance learning and 40 telemedicine projects. 30 states or territories were represented, and 71 of the 86 awarded received special consideration points for strike force, trust or tribal jurisdiction, or promise zones. On this slide is a link to a media release regarding the 2017 awards. In FY18, we have $29 million available, $20 million of additional funds available for opioid treatment projects. These distance learning and telemedicine grants fund equipment needed to provide distance learning and telemedicine. There is a 15% matching requirement. The minimum grant amount is $50,000 and the maximum grant amount is $500,000. This year, the NOSA was released April 3rd, and submissions must be received no later than June 4th. There are changes to the regulation in 2018. The governing regulation has been changed from 7 CFR Part 1703 subparts D, E, F, and G to 7 CFR Part 1734, subparts A, B, C, and D. Changes to the DLT grant program regulation include statutory requirements and non-statutory issues. The statutory changes. The revision of the appeals sections. In accordance with the statute, appeals are limited to RUS telecom and electric bars only. This year, RUS telecom and electric bars are eligible to apply, and the agency is now making broadband facilities as an eligible grant purpose. Non-statutory changes. The publication of the NOFA and or NOSA has been removed. Program announcements will now be made on grants.gov, the program website, and in the program application guide. Scoring criteria has been removed from the regulation and is now to be included in the announcements on grants.gov, the program application guide, and on the program website. The required leveraging, or more commonly referred to as match, has been reduced to a flat 15% of the grant amount requested. Scoring categories. There are now 4 scoring categories, 3 objective and 1 subjective, with a maximum of 110 points. Rurality can score up to 40 points, economic need up to 30 points, and there's a special considerations if requested for 10 points. This year, special consideration is being given for STEM education or opioid treatment. Service needs and benefits is the only subjective category and is worth 30 points. Economic need is being scored using the U.S. Census Small Area Income and Poverty Estimates, commonly referred to as SAPE. And this is the SAPE County data. Site license and maintenance contracts for equipment purchased as part of the project have been added to the list of approved grant purposes. Additionally, the 3-year allowable coverage for extended warranties, site license, and maintenance contracts has been identified as starting at the time of installation of the related equipment. The purchasing and installing of broadband facilities has been added as an approved grant purpose. This purpose is limited to a maximum of 20% of the requested grant amount and must be used for providing distance learning or telemedicine services. The awardee must own the final broadband asset in order for funding to be approved. Environmental requirements for broadband facilities. You are required to complete a project description including all aspects. You must be very clear if all aspects of projects are equipment purchases and within existing facilities or expanding outside of existing facilities. You must indicate the project location, latitude and longitude, or address is preferred, and where broadband facilities are proposed. If so, see the National Preservation Act and the Endangered Species Act. Questions, contact Lauren Cusick at wdc.usda.gov or 202-720-1414. Applicant assistance. Prior to the official submission of applications, applicants may request technical assistance or other application guidance from RUS as long as such requests are made 15 days prior to the final application due date. This does not mean that we will write your grant or help you write your grant, but we can give you assistance on things such as eligibility, eligibility of purpose, and things of that nature. Applicant eligibility. The following types are eligible to apply: incorporated organization, Indian tribe or tribal organization as defined in 25 U.S.C. 450 B.E., state or local unit of government, a consortium as defined in 1734.3, or other legal entity, including private corporation organized on a for-profit or not-for-profit basis. Basically, everyone can apply other than individuals or partnerships. A consortium. A consortium is a combination or group of entities formed to undertake the purpose for which the distance learning or telemedicine financial assistance is provided. If the applicant is an existing established consortium with the legal ability to contract with the federal government, that organization can apply in the name of the formal consortium. If the applicant is an informal consortium, which by itself lacks the legal capacity to contract, the consortium must have a legally organized host organization that will apply on its behalf, or each individual entity must contract with RUS on its own behalf. Each member of the informal consortium must provide signed copies of certifications. It is much better if you're an informal consortium to designate a lead and to have a lead applicant who will be responsible for implementing the grant and signing all the documents. It's a much simpler way to apply. An informal consortium may have a legally organized host organization which will apply on behalf of the consortium and be designated as the project owner with all awarding responsibilities. Categories of eligible grant purposes. Acquiring by lease or purchase eligible equipment. If leased, the cost of the lease during the 3-year life of the grant is eligible. Constructing broadband facilities to serve DLT purposes. Costs may not exceed 20% of the grant amount. Applicant must own the facilities. Acquiring instructional programming that is a capital asset, including the purchase of or lease of instructional programming already on the market. Providing technical assistance or instruction for using eligible equipment. The cost of this category cannot exceed 10% of the grant amount requested. As noted, all of these instructions or details are outlined in the application guide. Select ineligible purposes. To pay for medical or educational equipment not having telemedicine or distance learning as its essential function. To pay for electronic medical records. Medical equipment not used primarily for telemedicine. Primarily is defined as 50% or more. Salaries or administrative expenses. Application preparation cost. Purchase of land, buildings, building construction, site development, or destruction or alteration of buildings. Again, this is defined more in the application guide. The following are examples of eligible equipment. Computer hardware, software, computer network components, data terminal equipment, inside wiring, audio and video equipment, telecommunication terminal equipment, interactive audio video equipment, broadband facilities if owned by the applicant. The applicant must demonstrate that the predominant purpose, again 50% or more of use, of every line item in the grant and match budget meet the DLT definition of distance learning and or telemedicine. All equipment must be new and non-depreciated. Matching contribution. The grant applicant's matching contribution must equal 15% of the grant amount requested and be used for eligible grant purposes. There are special matching provisions for American Samoa, Guam, Virgin Islands, and the Northern Mariana Islands. Matching contributions cannot include any financial assistance from federal sources unless there's a federal statutory exception. This simply means that you cannot take another federal grant and use it as matching funds for this federal grant, unless it is specifically spelled out in the statutory description of the federal grant. Matching funds can either be cash or equipment used for the project, or may be in-kind contributions from a third party. Matching funds must be for a purpose that would be otherwise eligible for grant funding, i.e. no salaries, administrative expenses, or other items prohibited from grant funding, and must be integral to the overall DLT project and have a predominant DLT purpose. The value of in-kind contributions must be supported. Vendor discounts or supplied equipment is not an eligible in-kind contribution. Only new equipment may be used in a DLT project. Donations or use of partially or fully depreciated equipment are not allowable. Objective criteria. Now we go into the scoring. The rurality, this criteria measures rural benefit. The minimum score threshold for an application to be considered in the competition at all is 20 points. This category is based on census data, and you can get score up to 40 points. The economic need, or SAPE. Economic need is measured by the latest county SAPE poverty percentage, all ages, found in the U.S. Census SAPE data. This criterion will be used to evaluate the relative financial need of the applicant, community, and project. All applicants are required to provide the applicable SAPE percentage based on the county where the hub and end user sites as defined in 1734.3 are located. This is up to 30 points. Special consideration. 10 points will be awarded for projects with a STEM education purpose or opioid treatment and/or opioid treatment educational purpose. Applicants must request these points. The special consideration purpose must be fully defined in the executive summary and the needs and benefits section of the application. Special consideration, STEM. Now, for the purpose of DLT programs, STEM is defined as education in the various science, technology, engineering, and mathematics disciplines. STEM encompasses a wide range of academic and technical subjects, including the physical sciences, life sciences, natural sciences, information technology, engineering, and mathematics education. STEM includes healthcare programs that train students for careers in the medical or scientific research field. STEM also includes career, technical education, and/or apprenticeships in any of the STEM fields which can be considered applied STEM. For the purposes of special consideration points, STEM eligible purposes include classes offering STEM curriculum, training in STEM fields, including apprenticeships, laboratory or other equipment that contributes to the live interactive STEM curriculum. Special consideration for opioid treatment. For the purpose of the DLT program, opioid treatment is defined as the interactive communication between medical or educational professionals and opioid users or their families, other treatment professionals, or those who interact with opioid users. Special consideration opioid treatment. For the purpose of this program, eligible opioid treatment includes counseling of opioid users, treatment of opioid-dependent persons, training of medical professionals, counselors, or first responders in their interaction with opioid users, educational programs addressing opioid abuse. The one subjective category we have now is the need for services and project benefits, commonly referred to as needs and benefits. This criterion compares the specific need for technology in the proposed service territory and how the proposed project will address those needs and benefit the residents. Up to 30 points. These are the required documents. A through L, standard form 424 with attachments, an executive summary of the project, the scoring criteria documentation, which we just went over, the matching requirements, which we have reviewed, the scope of work, the financial information and sustainability, the statement of experience, telecommunications systems plan, compliance with other federal statutes, evidence of legal authority and existence, environmental impact and historic preservation, and consultation with the state director. The overview of the worksheets are in Appendix A of the application guide. The worksheets include the site worksheet, the reality worksheet, economic need worksheet, the matching worksheet, the special consideration worksheet, and the budget worksheet. All these are required to be submitted. Overview of the worksheets. Here is the site worksheet. Then the instructions for completing the site worksheet. If using the Excel worksheets provided at our website, listed here, please insert additional rows if needed to accommodate your sites. If using printed form, please use additional copies as needed to list all of your sites. Site number. Number each site consecutively regardless of its designation. The number should be used consistently to identify each site in the site worksheet, reality worksheet, and the economic need worksheet. In other words, keep to the letter the order of your sites in the same order on all of your worksheets. This just aids in reviewing and scoring. Reality worksheet. You have 4 categories. Exceptionally rural. Any area of the U.S. not included within the boundaries of any incorporated or unincorporated city, village, or borough having a population in excess of 5,000 inhabitants. $5,000 or fewer. If you have a population inside 5,000 or fewer, you will receive 40 points. Rural is between 5,001 and 10,000. Receive 30 points. Mid-rural, between 10,001 and 20,000, you will receive 20 points. And if you have an insight in an urban area, which is 20,001 or more, you will receive 0 points. Now that's not to say that you cannot have insights in urban areas, but you just won't get any points for that particular insight. Economic need. Again, this is taken off the census data, census SAPE data. If you have a county percentage of 30% or greater, then you have 30 points. If your SAPE is between 20 and 30, you will get 20 points. If your SAPE is between 10 and 20, you will get 10 points. And if it's under 10, then you will receive 0 points. Matching worksheet. You must provide You must document your matching funds as described in the application guide. Place letters of financial commitment and other match documentation along with this form under tab C3 of your application package. Each donor's match must be supported by a matching letter. Matches not properly documented will not be credited. Depending on the consequent reduction of your match, this could lower your score and make your project ineligible. That is, if the resulting match is 15%. So if you have multiple match people donating money or giving you money as match, be sure you get supporting documents from each of the organizations that are donating or giving you matching funds for your grant. If we do not have supporting documentation, their portion of the match will be removed. Special consideration worksheets. We ask that you submit this so it's very clear that you're requesting special consideration. You will check STEM or opioid. It should be signed by an authorized representative and dated. Budget worksheet, very important. You have to have your budget defined. You need to list all of your equipment, which site it's going into, the description, the unit cost, number of units, and the extension. And if you have whether it's an in-kind, if it's an in-kind match, you must designate that in the in-kind column. Additional registration requirements. You must have a D&B number. As required by the Office of Management and Budget, OMB, all applicants for grants must supply a Dun & Bradstreet Data Universal Numbering System, DUNS, commonly referred to as DUNS, when applying. The standard form SF424 contains a blank to enter your DUNS number. The DUNS number can be obtained free of charge by calling Dun & Bradstreet or contacting the link below to apply. You must have a System of Award Management registration, commonly referred to as a SAM registration. The applicants, whether applying electronically or by paper, also must register in the System for Award Management prior to submitting an application. Applicants may register for SAM at www.sam.gov. Applicants should keep in mind that it can take up to 10 business days to register with SAM. Applicants should plan accordingly and begin the process well in advance of the application deadline. Please note that SAM registration must remain active with current information at all times while RUS is considering an application or while a federal grant award or loan is active. To maintain a registration in the SAM database, the applicant must review and update the information in the SAM database annually from the date of initial registration or from the date of the last update. The applicant must ensure that the information in the database is current, accurate, and complete. CFR 200, Procurement and Audit Requirements for Federal Grant Recipients. Awards under the program, the DLT program, are covered by this regulation. 2 CFR 200-319. Contractors that developed or draft specifications, requirements, statements of work, and invitations for bids or requests for proposals must be excluded from competing for such procurements. Please see the CFR for procurement and other administrative requirements that apply. And below is the link to the CFR 200. Basically, this means that a vendor or a grant writer paid by a vendor and they write your grant for you, they are excluded from you buying equipment from them. You cannot procure equipment from them, and you cannot invite them in the bidding process. Application submission. They can be submitted electronically through grants.gov, or they can be postmarked, shipped, or hand-delivered. 2 paper copies of a completed application, one with original signatures, accompanied by an electronic version in the form of a USB flash drive. A couple of notes here that if you submit through grants.gov, please do so several days in advance in case you run into technical difficulties. And also, please, once you've submitted, please go back in and double check that all of your attachments were transmitted. If that didn't happen, then please resubmit with your attachments and double check. Also, if you submit paper copies with a flash drive and you make changes on the paper copies, please update the flash drive or vice versa. Here's the address that you can submit paper applications to: the Deputy Assistant Administrator, Loan Origination and Approval Division, Rural Utility Service, Stop 1597, Room 2844, 1400 Independence Avenue, Southwest, Washington, D.C. 20250-1597. Here is the link to our website, USDA RD, USDA.gov, Programs and Services, Distance Learning, Telemedicine Grants. And please note, if you get to this website and you need resources, there are 2 tabs at the top. Please click on the Forms and Resources tab so that you can access the application guide and worksheets. Here's our email address. It's very simple. It's dltinfo@wdc.usda.gov, and it will come into an email inbox, and someone should respond to you, typically within the same day. We try our best we can to stay up on top of those and respond as quickly as possible. You may also call this number, 202-720-0800, and the staff that answers the phone will transfer you to someone who can help you answer your questions. And that's the end of this webinar. I hope it has been useful, and I would encourage, if you're interested, to please go to the website and double check the application guide and requirements. And if you have further questions, please contact us through either phone or email, and we'll be happy to assist you. Thank you very much.